Hi, I'm Wei Han from the IDEA Asia Pacific. Thank you very much for this opportunity to present the work on HIV treatment outcomes among people who acquire HIV from injecting drug use in the Asia Pacific. Injecting drug use is a major global public health concern leading to substantial health burden across different settings, including the Asia Pacific region. Previously, it was estimated that there were nearly 4 million people who inject drugs in East and Southeast Asia. We investigated the HIV treatment outcomes, including CD4 recovery, virus suppression, and AIDS events and deaths among persons who acquire HIV in association with injecting drug use. The eligibility criteria include people living with HIV aged more than or equal 18 years, who reported injecting drug use at their enrollment as the primary mode of HIV acquisition in this Asian Tahod cohort of the IDEA Asia Pacific region between the period of 2003 and 2019. And those with more than or equal 1 CD4 count and more than or equal 1 viral measurement after 6 months of ART initiation were included. We used the repeated measure linear regression models to identify the effect associated with the CD4 changes over 10 years of ART initiation. The proportion of viral suppression over time were also calculated. The viral suppression was defined as the HIV RNA less than 400 copies per mil. Also, cost proportional hazard model was used to identify the incidence of tuberculosis and combined AIDS event and deaths. A total of 622 PDYD participants were included. Among them, 93% were male, 82% were from low and middle income countries. The median age at ART initiation was 31 years. The prevalence of hepatitis B and hepatitis C co-infection was 10% and 71% respectively. At the ART initiation, 32% was started with the CD4 less than 50, and 13% started with CD4 between 50 and 100, and 54% had a history of AIDS diagnosis before ART initiation. On the figures on the right, you can see the overall median CD4 count increases over the time after ART initiation. And the higher CD4 count have a slightly higher CD4 gain over the years of ART initiation. In the regression model, we found the lower pre-ART CD4 levels and suppressed follow-up HIV RNA predicted larger CD4 gain over the time. The proportion of viral suppression among 361 patients who had at least 1 viral measurement after 6 months of ART initiation was 83% at year 1, 82% at year 3, and 93% at year 10, respectively. Over nearly 3,500 person years, there were 35 new TB cases identified with an incident rate of 1.01 per 100 person years. And also over nearly 3,300 person years follow-up, there were 52 AIDS events and 50 deaths with a combined incidence rate of 3.05 per 100 person years. In the cost regression model, we found the history of AIDS diagnoses, lower follow-up CD4, and higher HIV RNA predicted the AIDS events and mortality. So CD4 and proportional viral suppression continue to increase up to 10 years after ART initiation. We also see the greater CD4 increases among those with lower pre-ART CD4 and those with suppressed follow-up HIV viral load. Previous AIDS diagnoses and low follow-up CD4 was associated with the higher chances of AIDS events and mortality. The limitation of this study includes we didn't include a data on the subsequent drug use or the type of drugs, and 70% started ART during the time of 2008 and 2012. Therefore, which could be potentially limiting the generalizability of our findings to treat all period. With that, I'd like to thank to my all supervisors, writing group members of this concept sheet, and also Tahod study participant and site investigator for their contributions. And lastly, I'd like to thank 3Asia team for their support. Thank you very much for your attention.